afternoon and welcome. Today is a day we all get to celebrate a little bit, which is a great thing. You know, this past year we've been through a lot of uncertainty and a lot of uncertain times, to be sure, but today is a day where we can look forward to a bright future. We've emerged from our court-sponsored reorganization, and we now have the opportunity, which is seldom afforded in life, to hit the reset button and to do it all again, and this time really fulfill our mission and our promise to helping change healthcare in America. We emerge today as a new company with new owners, a private company now instead of a public company, which, by the way, in my opinion, has some distinct advantages. Not only does it give us the ability to be more open in our communications with people, but it also gives us a real opportunity to focus strategically on just how we can fulfill our mission and help change the way healthcare is delivered in America. I want to thank all of you for sticking with us during this time of uncertainty. I know it's not been easy, but here we are today with an opportunity to really progress forward. Now, as I look back on this past year, something happened in, I think it was mid to late November. I was on the phone with an old contact of mine with a company called Deerfield Management in New York City. And I talked to this individual and I said, you know, we need some help. We need the help of some really smart people who know the healthcare business inside and out, and who really can come and get to know us as an organization and see the promise that I see here and help us build a new future. Well, the Deerfield folks took us up on that opportunity, came in, really rolled up their sleeves and got to work. And that partnership has grown stronger and stronger over the last 6 or 8 months. And the Deerfield folks are here with their knowledge, certainly with their financial support, but with a really completely in-depth understanding of healthcare in this country and an ability to really help us achieve our mission and our goals going forward. And now I'd like to hand this over to Mr. Alex Karnal from Deerfield Management.
I'm very excited to be here with everyone today. It's been one heck of a journey. There were times when it looked like our doors might close, and there were times where it felt like success was just around the corner. Throughout it all, it was the hard work, dedication, and discipline of the entire team that enabled us to get to the other side of this process. It was a heroic effort not just to get through this bankruptcy, but to do it while surviving one of the most rigorous and disastrous storms to hit our country. I'm so proud of everything that you have all accomplished together, and I'm so proud to be joining the Adeptus family today. When I think about the path ahead and the opportunity for us in joining forces between Deerfield and Adeptus, it's quite large. As we sit back and think about the future of healthcare, we see the hospital system as it exists today as broken. We think the centralized hospital model is one that's flawed. We are excited about our partnership with Adeptus, and we very much believe in the model of bringing emergency care right to the communities that so desperately need them. As we think about access and the ability to deliver high-quality outcomes to patients, there's nobody who's better positioned to do that and to do it in an efficient, local manner than you, the team here at Adeptus. In thinking about Deerfield Management and our commitment to this company, I think some of our history and context will be helpful. Deerfield was founded by a man named Arnie Snyder over 23 years ago, and Arnie had a vision for a different type of company. A company that was grounded in collaboration, communication, partnership, and respect for each other in a way that was different from other companies, in a way where we could rely on each other to get complicated tasks accomplished, in very much the way we rely on each of you to deliver amazing healthcare to your communities. Together at Deerfield, we manage over $8 billion of investments in the healthcare space, and our mission is to advance healthcare in every way we can. As I think back on this process, so many people have contributed to getting us to where we are today. One person in particular was a major contributor to that. This person demonstrated a unique ability to be creative, to persevere, to lead, and to help us conquer some really complicated tasks throughout it. So it is with great honor that I introduce to you Frank Williams as the future CEO of Adeptus. We have a tremendous amount of trust and confidence in his ability to lead this organization, and more importantly, we believe he's aligned with the culture of Deerfield, with a focus on culture, teamwork, collaboration, and a transformation of the way things used to be done at this company. I leave you in great hands, and to Frank I say, let's go get him.
Good afternoon. I'm pleased to be able to provide this update with our partners from Deerfield Management and thank everybody to start with for the extraordinary efforts that everybody has put forth over the last 6 months as we've gone through the bankruptcy process. The one constant that we saw throughout the entire process was the fact that the quality of care delivered in our facilities never decreased at all, and patient satisfaction remained at the highest levels. And that is, frankly, the core principle that is going to allow this company to thrive going forward. We're committed to the delivery of high-quality patient care in neighborhood settings, filling a need that this country has for emergency care. And those efforts start in our facilities with our frontline providers of care. We're committed to growing this business. We have a very bright future, and we're going to be good stewards of the capital that we've been entrusted with, but we have bright opportunities. We need to be extremely conscious about costs, and so over time we will continue to adjust our portfolio, and that will cause us to close a limited number of facilities. But on the other hand, we'll open facilities. We're excited to be opening the facility at Carrollton Beltline in the next month, and last month we opened a facility in Austin, Texas. And while each of you was working very hard during the bankruptcy process providing outstanding patient care, I know there were other topics that were at the front of your mind: 401k, facilities, benefits, and I want to assure each of you that those are priorities for us as well. And we continue to work very hard to resolve issues, and we will commit to be transparent and keep you updated as we progress. In summary, I again want to thank each of you for the extraordinary patient care that you continue to provide. It's a hallmark of this company, and it will allow us to be successful going forward. I'm excited over the next month to be able to visit each of our markets and our facilities and see many of you. Thank you.